Did you know that 1 out of 4 adults over the age of 65 experience a fall each year? More importantly, did you know that many of those falls are actually preventable? Well, as a neurorehabilitation physician and a lifestyle medicine specialist, I want to share with you 7 modifiable risk factors that will increase your risk of falls. And I'm going to tell you what you can do to reduce your falls risk. So number 1 is vision impairment. As we get older, our vision naturally declines, making it harder to see things like the curb, steps, and obstacles. What you want to do is to get regular eye exam, keep your eyeglasses up to date, use brighter lighting at home. Number 2 is muscle weakness. As we get older, the strength, particularly in our legs, tend to get weaker. And it makes it hard to catch ourselves if we trip. What we want to do is to include strength training 2 to 3 times a week. Do things like sit to stand exercises or step up. Try walking with a weighted vest like I do, as this can help to build strength. And I'll also share the link to the one that I use. Number 3 is balance problems. Balance tend to naturally decline with age, but you can actually train it. So the tips include add balance exercises like standing on one leg or heel to toe walks. Make sure that you're careful to hold on to something supportive until you can do it without support. Consider things like Tai Chi or yoga classes, as these can help with balance. If you are someone with Parkinson's disease, consider programs aimed at patients with Parkinson's, as many of these programs focus heavily on balance training. And use the assistive devices if you need it. I have patients who sometimes need the walker or the cane, but sometimes out of vanity, they don't want to use it. Use them if you need them. The primary goal is to keep you safe and prevent falls. Number 4 is neuropathy and foot problems. Numbness, pain, lack of awareness of where your feet are in space, also known as proprioception, or poor foot mechanics can affect how you walk and how you react to uneven surfaces. What you want to do is to check your feet regularly for any injuries or changes. This is particularly important if you are diabetic or if you have any kind of vascular or circulation impairment. By the way, you can actually check the sole of your feet using the mirror, and you also want to check in between toes. Another thing is to wear shoes that offer support and are proper fitting. In addition, if you have numbness or tingling, report it right away to your doctor. When blood sugars aren't controlled, it puts you at risk for neuropathy. So that's another thing, is you want to ensure that your blood sugar is properly controlled, and implementing good lifestyle, looking at what you eat, and making sure you're moving and taking your medications as prescribed will be helpful. Number 5, modifiable risk factor is orthostatic hypotension. That's a drop in blood pressure, particularly when you change position quickly. Like if you get up from a seated position and you stand, you might get dizzy and you might fall. So the tip is to change position slowly, stay hydrated, monitor your blood pressure at home, and keep track of those numbers for your doctor's visit. I will share a link to my health logbook that you're able to write those numbers down and take it to your doctor. If you experience dizziness, share that with your doctor. Ask your doctor to review your blood pressure medications. I've seen situations where people start eating healthier and they start exercising, and those two things can help to lower the blood pressure. But then the blood pressure medicine remains the same. So now the blood pressure is really low. This is why I often say to you, if you're going to make any lifestyle changes, share that with your doctor. Your doctor needs to know that, because that lifestyle change, although it's a good thing, if the combination of the lifestyle change and the medication is too much, the doctor needs to know. Number 6 is the high-risk medications. Medications like sedatives, blood pressure medication, as I mentioned before, blood sugar medication, certain allergy medications like Benadryl, those that you take for sleep and anxiety, they can increase your risk of falls for different reasons. So make sure that you review your medication with your doctor. In fact, I encourage people to take the medications to the doctor. I once had a patient who was on the same medication, taking it a double dose because one doctor prescribed the generic and then she went somewhere else. And I think she saw a nurse practitioner who prescribed the brand. And so now she's taking both medications. These people are talking to each other. And because she brought the medications in, I was able to see that. So bring the medications and go over the medications. Never stop taking your medication on your own, but certainly ask your doctor periodically to review and see if there's any room for de-prescribing. Many patients, as they get older, are on tons of medication, what we call polypharmacy. They're taking so many different medications. And sometimes when your doctor sits and goes through the list, they're able to say, okay, maybe you don't need this anymore, or maybe we can lower that dose. Never do it on your own, but certainly ask that doctor to take a look at it. The other thing is never stop a medicine suddenly. Ask the doctor if you're able to do that, right? Some medications have to be tapered. So you want to make sure that you never stop something suddenly unless you are told to do so. The other thing is, remember that some of these medications will affect your alertness and your awareness. Number 7, the final one, is to look at hazards in your environment. Things like throw rugs, poor lighting, clutter, or even improper footwear can put you at risk of falls. Remove the loose rugs or secure them. Improve the lighting, especially near the stairs. Use grab bars in the bathroom. Keep the pathways clear and wear shoes with non-slip bottoms. The bottom line is that falls happen a lot as we age, but it doesn't have to happen to you. So let's take steps to modify your risk of falls because, again, we want you safe and we want you healthy as you age. I've often shared with you that my beloved great-grandmother died at the age of 98. She was living her best life and she had a fall, broke her hip, and died from complications of that. And so we want to ensure that you keep safe and we want to reduce your risk of falls. Thank you so much for listening. And don't forget to like, share, and subscribe for more on healthy aging and longevity for women over the age of 50.